Hello, everyone. Welcome back to our channel. I'm Dr. B from Doc Be Well. Today, we're going to be diving into the world of upper respiratory infections. We're going to talk about the symptoms, treatments, and how telehealth can play a crucial role in managing them. As always, make sure to consult your healthcare professional for personalized advice. The following information is meant to be a resource, but not medical advice. Opinions are my own, but based on over a decade with direct patient care. Please consult your primary care provider for questions or concerns. So, what is an upper respiratory tract infection? The common cold. Today, we will be discussing what it is and how do I treat it. The treatments that are not recommended, but the treatments that are recommended. How can I prevent getting a cold, and can you use telehealth to evaluate patients with a cold? So the common cold is a self-limiting syndrome that's generally caused by a virus. The symptoms may include nasal congestion or discharge, sneezing, sore throat, cough, low-grade fever, headache, and malaise. The symptoms can last for up to 10 days, but the cough can linger for a few weeks, especially in smokers. I generally tell my patients who are smoking that the respiratory cilia, the little hairs that are in your respiratory tract, are stunned by the cigarette smoking, and it can take up to 4 to 6 weeks for those cilia to regenerate. Therefore, you'll probably have to cough during that period of time in order to bring up the secretions. The common cold is passed from person to person through saliva and nasal secretions. This is an important part when we talk about how to prevent it. It is not influenza, it is not COVID-19, not bacterial pharyngitis, acute bronchitis, acute bacterial sinusitis, or allergic rhinitis or pertussis. These have similar symptoms to an upper respiratory infection, but have different treatments, and therefore it is important for you to consult with your primary care provider in order to figure out which one of these you may have. Acetaminophen, or Tylenol, and nonsteroidal anti-inflammatory drugs like ibuprofen, Aleve, and naproxen, these are useful and found to be helpful for pain reduction and fever reduction. Additional treatment options include a combination of antihistamines and decongestants, but this is better together than taken alone. Antihistamines are things like Benadryl, Claritin, Zyrtec, Allegra, and decongestants are like Sudafed. Although I do need to give a caution to the folks who are struggling with high blood pressure. Decongestants have been known to increase your blood pressure, and it's best to consult your physician before starting on one of these medicines. Intranasal or inhalational cromolyn sodium. Nasal Chrome, nasal spray allergy, is available for purchase through my affiliate link on the website. It relieves allergy symptoms and prevents and controls nasal allergy symptoms occurring in the first place. It is not a steroid, and it is over the counter and safe to use for kids ages 2 and up. Additionally, I recommend for my patient to make sure that they get plenty of rest and sleep. I have also discussed the use of honey for my patients and children older than 1 year that helps with cough. Hydration with hot tea and soup. Nasal saline irrigation. Menthol rub, like Vicks Vapor Rub, can be applied to the chest at night for kids over 2 years of age to help with congestion. There is additional evidence that points to zinc acetate or zinc gluconate being useful in helping reduce the symptoms and severity of a cold. Now, here's a list of things that are not shown to be helpful. And end, the Choosing Wisely campaign also recommends that primary care providers do not provide antibiotics for viral respiratory illnesses. They are shown to be of no benefit, and they can be harmful if used inappropriately. Codeine or other antitussive medications are not helpful. However, you could use honey instead, or Delsum cough syrup has been shown to be useful, at least in my patients. Steam or humidified air has also been studied and not found to be of great use. The use of vitamin C, vitamin D, or E have been studied but found not to be useful more than placebo. Additionally, folks who are taking vitamin E supplementation may experience worsening of their cold symptoms. It is strongly encouraged for you to avoid. Echinacea is also not found to be helpful. Prevention is the key, and hand hygiene, masking, and keeping yourself healthy are the three pillars that will help to prevent you from getting a cold in the first place. Washing your hands if you were to touch your face is also helpful. Masks do work. Masks work. Enough said. And if used appropriately, we do know that they are helpful. Keeping yourself healthy by eating a variety of fruits and vegetables and a heart-healthy diet is important to help maintain your ultimate health. So telemedicine is a convenient method for evaluating a cold in your own space at your own time. Symptoms can be assessed and treatment options discussed. The telemedicine provider can review your personal medical history and medications. They can also provide work release notes and help communicate with your employer. The telehealth provider will identify concerning symptoms that may need further evaluation, possibly additional testing, or an in-person visit. DrB has transparent pricing to make this consultation easy and affordable. Visit us at www.drbwell.com and schedule your appointment today. Here's a few references that I have for today's talk. I really hope that you've enjoyed it. Thank you so much for coming out today. Stay tuned for more. If you like this material and want to see more, please leave a like and a comment below on other things that you'd like us to discuss. From my home to yours, thank you for joining me.